Yes, I did, Tim.
Okay, so we are now recording. Okay, good afternoon, everybody, and welcome to the Nevada County COVID-19 Business Task Force meeting. Hang on, I'm hearing myself on YouTube. How's that happening?
We're hearing you too, Caleb, by the way, so. Is Tim Corkins on this Zoom? You're still
He
letting,
is. He
we're still
is.
letting him in?
Okay, let me try that again.
Chat
So, all right, welcome everybody to the Nevada County COVID-19 Business Task Force meeting, and this meeting is being recorded. It is also streaming live on YouTube. We have a good agenda today. Update on public health, new business resources from the state and federal level, and a special presentation on platform kitchen operations. So with that, let me kick it over to Supervisor Miller for welcome.
Welcome.
I see you dressed up.
Yeah, I did. I got my Nevada EU gear on today. So I've just been running around trying to get a lot of things done, and then I ended up here at the Root Center. So who is to figure that one out? Ed's still in the same place, right, Ed?
Right, Dan.
Anything you want to add, Supervisor Schofield?
Well, just that Amy kind of hit it on the nose that the best day we could possibly have is the day we're through with this COVID stuff. And you kind of said the key word, Caleb, that's really so hard at this point, and that's patience. And I'm saying it to myself as much as anybody, so.
Yeah, I removed that word from the dictionary for my.
You removed it?
Yeah, it's gone.
All right, good. Well, thank you both for that. And just to remind people that this is a webinar format, so you can put questions in the chat. There's also a Q&A tab down below. You can click and post there, and those of us on the panel will monitor that and see if we can answer them while we're going. And with that, let me turn it over to Ryan Gruber for the public health update. Ryan.
Hi, thanks for having me again. And I will just echo the eagerness to get back to normalcy. That has been our sole focus, is to protect the community and to help us get back to normalcy as quickly as possible. And I think we all got some disappointing news this week when we saw that in terms of the weekly data update for the blueprint for a safer economy, we remain in the purple tier. So our case rate stayed flat compared to the week before, and our positivity rate actually increased somewhat. So you'll recall from my previous presentations what those mean, but basically our number of cases per day and the percentage of tests that ended up with a positive result. So this is very frustrating for myself included. I think we need to be careful about not reading too much into 1 week's worth of data. As a small county, we do tend to jump around quite a bit, and the broader trend is one of improvement. So I'm going to be watching next week very closely. We declined from a peak of nearly 400 cases per week in early December to 85 cases last week, a little fewer the week before that. We typically have larger updates on Mondays because it includes the new cases from the weekend. And I will point out that yesterday we had only 31, which is the lowest Monday update that we've had since November 9th. Not to read too much into that, but just to reiterate that overall the trend is positive. Another really positive thing is that our active cases have declined dramatically. They spiked dramatically when we saw the huge uptick in cases in the during the surge. And now we're at the other end of that, where they've started to decline rapidly to where we're now at 49 cases, 49 active cases, which is a manageable number. It means that our public health team can swing in with the with contact tracing, investigation, and advising people on how they can not spread it to their neighbors and their friends. And that's a key tool that when it was at 600 cases, almost 600 cases, we had to prioritize and only reach the most vulnerable, the older people, and then kids. And now we're able to get to more of those people, and that can only help and be positive. So I think the key takeaways from my perspective are not to lose it over 1 week's worth of data, and to continue to be vigilant, because we have a ways to go to contain transmission, to get to red and then orange and then yellow and then green, which is the light at the end of the tunnel. Right now, we don't have nearly enough vaccine to get to herd immunity, but we're pulling out all the stops to get there. And so I'll just transition into the vaccine update, which is that we have made great progress on vaccinations. When the state started reporting vaccinations by county of residence on January 29th, we were at 5,700 shots in arms for Nevada County residents. And as of yesterday, we were just under 25,000. So that's huge progress over basically a month's time. We've coordinated with providers and community members that have really leaned into vaccinating the community, including Docomo's, Tahoe Forest Hospital, our federally qualified health centers, and others. And then we stood up a high throughput mass vaccination site on Whispering Pines in partnership with Sierra Nevada Memorial Hospital that is able to vaccinate more and more of the community. We were among the first in the state to be able to vaccinate teachers and emergency responders. And we're also working through the highest risk people in the food and ag sector. We have a reach team that's going out and getting to underserved communities and congregate settings. And right now, due to our relatively older population, we're getting a higher percentage proportionally of vaccine than some other counties. Our website has a robust list of providers, including some new sources. We're getting vaccine directly from the federal government to CVS on Comby Road and Walgreens on Sutton Way, and more people have been able to get their shots at those locations. We are one of the first in the state to go to the My Turn system, which definitely had some growing pains, but pretty soon everybody's going to be required to get onto that. And so we're working out those growing pains earlier in the process. And then I'll just say that more and more of our population is getting vaccinated. We stood up last week, we created a standby list so that when we get to the end of a clinic, if we have extra doses, we have a list of people who can get there quickly. And this week, by the time we actually used that list, we were able to remove 200 people because they had already gotten their vaccine from the time that they signed up from that list for that list last week to this week when we started using it. So we are making progress. That is what that layered with continued vigilance is what's going to allow us to really advance through that framework along with the rest of the state. And I think we'll see more and more loosening as we do that, and we start to see the benefit of the immunity that the vaccine will provide. So I think I'll stop there. Yeah.
Question. Are we seeing a decline, which I thought I read today, a decline in the number of testings? And so, if we are, do you think that's relative to the fact that people think they're going to get a vaccine and so they're not thinking it's important?
So I hope that it's not because of that. We are definitely seeing a decline in utilization of testing, as is much of the state. So the statewide, the state calculates an average number of tests per day and per week, and that has declined statewide, and it's declined in Nevada County as well. That tends to fluctuate with sort of the case rates, and as people get more concerned, they tend to go in for testing more. And then we saw a huge surge in demand in testing when we were in the midst of the COVID surge that has now declined. That plays into the framework metrics, because if only sick people are getting tested, then our positivity rate is poor. But on the other hand, we're pretty good on positivity rate. So so the more people you identify as new cases, the worse our case rate gets. And so yes, the short answer is that testing demand has declined, but it is consistent with broader trends across the state. Did I answer your question? It doesn't.
Yeah, you did. And I guess I'm I'm not, it's not that I'm perplexed. It's just that if our testing was higher, and which would affect our positivity rate, then it'd be possible that we could have been in the red tier. Is that?
No, because we get placed in the tier of our worst metric, right? And so our positivity is already in the red tier. It was actually orange last week and went to red this week. Our case rate has remained in purple. So that's the one that needed to get down in order for us to hit the red tier.
Ryan, we got 2 questions from Tim. How many doses of vaccine are we getting each week? And does the number include first and second doses?
So I don't have the exact number. We're getting in the neighborhood of, I think we got 4,700 first doses last week. I don't know how many we're getting this week, but they are coming in still distinctly as first and second doses, even though what's in that vial is actually the same thing. So supply is increasing. We're getting a higher proportion of it as we work through our 65 plus. And then what we understand is that Johnson & Johnson is going to be coming very soon as well. And so we're getting more and more of it. And we're trying to scale our capacity to make sure that we can continue to get it into arms as fast as we get it. He said he had a couple questions. I didn't see the other one.
No, that was them.
Okay.
I combined them. Any other questions or
Quick
comments
question,
for,
Caleb.
go ahead, Supervisor.
Ryan, I know a lot of our folks have gone down to Sutter. So how are they being impacted if they're getting their second vaccine, and Sutter and Sacramento is now, or Placer? Sutter, I guess it is short of vaccines. Does that affect us?
So, I mean, it could well affect the people that got their first dose through Sutter if the second dose is not available. So we are strongly urging people to go where they got their first dose to get their second dose. We make those second dose appointments at the same time that we make the first dose appointments. And most providers do a pretty good job of managing their inventory. It's something that they do with all vaccines in normal times. There was a time when there was a lot of talk about, well, don't worry about the second doses, just get as many first doses in arms as possible. And I have heard that some providers in other areas did get into a little trouble in terms of using stuff and then not getting the supply for second doses, particularly when we had delays related to the weather events in Texas. And so I have heard of people having to pause first dose clinics in order to get through more second doses.
That it does not matter if there is a delay, though, of a week, say?
Yeah, they're not saying that you have to get your first dose again if you missed that second dose appointment by a week. There's no time limit on when you can get that second dose. It's just the studies that they've done. It's most effective if you get Moderna 4 weeks after and Pfizer 3 weeks after, but they don't make you, if you get it sooner, they don't make you do it again. If you get it later, they don't make you repeat the first dose, if that helps.
Got it. That's good. Thank you, Ryan.
Ryan, anything else you want to add? All right. Well, not seeing other questions, so thank you. And wait a minute, Supervisor Miller.
One more question. How's the contact tracing going?
So the contact tracing, as I indicated, with the lower number of active cases, they are able to ramp back up and get to more of them. When we had 600 cases, there was a large group that we couldn't get to, and so it became difficult. To be able to tell people, short of other than just an email or a letter, what they should be doing to protect people, but also to identify where they were getting infected and do those investigations. So being able to do that again both helps us with that data and helps us trace back and find more people and contain more of it. So that is something that we're ramping back up. We also, a lot of folks have been pulled into vaccination efforts. So having the lower level of active cases is extremely helpful to containing the cases that we do get.
All right. Thank you very much. Let's go to the business resources update, and Kristen York and Leslie Williams from the Sierra Business Council are here to tell us about federal programs, state programs, and local resources. Kristen.
We sure are, Caleb. I'll start and then I'll let Leslie jump in. We had California made a new announcement today regarding the additional funding that Governor Newsom approved and the legislature passed. It's $2 billion in additional funding to be channeled directly to small businesses and nonprofits. So here's how it's going to work. There was 4 rounds for this funding. The first round opens Friday. That is for, it's not an open round. So this is for eligible applicants from rounds 1 and 2 whose applications were waitlisted. There's no need to reapply. And in fact, you can't reapply. The portal is not open. But if you had an application in and you heard nothing, then cross your fingers for round 3. That will be awarded within, I think they're going to take about 5 days to determine who will receive that money. Then the following week, we move into round 4. That application period opens on March 16th. That is specifically and only for nonprofit arts and culture grants. I believe the set aside is 50 million specifically for arts and culture. Must be nonprofit, cannot be a for-profit. If you are a nonprofit arts and culture organization who applied in round 1 or 2, you need to reapply. This is a different application, which is not open yet. However, you would still go to California Relief Grant. The grants will be determined by, they'll be tiered by the amount of loss year over year, so quarter over quarter between 2019 and 2020. So that's round 4. Then we go to round 5 and 6. So round 5 will open on March 25th, close March 31st. That will include the leftover waitlisted businesses and new businesses. So this is where people that didn't get in can apply. So not until March 25th if you're a business that missed out. Round 6 dates have to be determined, but we're into April then, and my gosh, maybe we'll be in orange by then too. So who knows? So that's our update for what's going on with the state of California. Again, no need to reapply for this first round, which closes next week. But if you are nonprofits, arts and culture, this is really important. You don't have to have fixed seats. So unlike the SBA shuttered venue, if you have flexible seating, you are eligible for this grant. And I know Miners Foundry, I know a number of the theaters in Nevada County this will apply for. It's up to $25,000. So not a huge amount of money, but it's better than zero. And I'll let Leslie talk about PPP unless there's any specific questions about state of California.
I'm not seeing any yet. Why don't we continue with the presentation, see if we get more questions?
Okay. Leslie, you there? I saw you.
I'm here.
Christine.
Thank you. Sorry,
Great.
Kristen. So just to piggyback onto what Kristen said, I'm putting into the chat right now. Lendistry is still the lender. It's a state grant, but the application is online through the lender by the name of Lendistry. So careliefgrant.com is where you would go to get all this information, because it was quite a bunch of data today to hear about, but you can go online and they have it all logged out. And then as far as PPP, anybody who has not applied for a Paycheck Protection Program loan can, that would be called PPP First Draw. Anybody who has received a PPP loan before can apply for a second Paycheck Protection Program loan. You still do that through your lenders. You need to determine if your first PPP loan lender is participating. So all the lenders have gone online. So just go to your bank's website and see if they have a banner up top. They all have COVID-19 banners. They all have PPP banners. So you can find out if they're participating or not, and you have to apply with them. And we're here to help without a doubt. If you don't have a lender at all, you can go to the link that I put in the chat at sba.gov, funding programs, loans, lender match. So you put your information in there and SBA will let you know which lenders you can be matched up with, because the Small Business Administration does have to approve a lender to participate in this program. And there's about 5,000 lenders nationwide. Other than that, real specific questions. We have a finance center that's helping us that has additional staff that supports Kristen and I and all the phone calls. So we can get you one-on-one real specific questions, especially for those who are having challenges with forgiveness, which is part of the first PPP loans from last year. So it's a little bit of a quagmire with all of this information, but those two sites would help, I think, alleviate a lot of the issues. Both are done through lenders, even though one's a state program and one's a federal program. And the EIDL loan, which is a federal program, EIDL, Economic Injury Disaster Loan, is still open. It is a loan. It's a 30-year loan. Anybody that had impacts from COVID, it's been extended through December 31st, 2021. So they've added an entire year to that disaster funding. They meaning the federal government.
Leslie, you have a question from Robin Davies. Does the first draw PPP loan need to be forgiven before reapplying for a second draw?
No, it does not. And your lender can help you with that. And if you haven't gone for forgiveness yet, it's kind of a good thing because the new legislation reversed what that first CARES Act legislation had, where if you had received an emergency advance from the EIDL, Office of Disaster Assistance, it was subtracted from your bank's forgiveness. So you actually ended up with a loan. And that's all been reversed. So if anybody's out there that's paying back a PPP loan after having received forgiveness and their EIDL emergency advance was subtracted from the loan forgiveness, that will be corrected. So stay in touch with your lender. SBA is communicating to the lenders. They know who you are. It's going to take a while, but everything will be washed backwards. The loan will be paid off. You won't have to accrue. The interest will be reversed. So that's really good news.
I want to add on, I did just put the website for the workshops on PPP forgiveness. They're very good. They're live. They walk through the process and then there's live questions. That's at asksbdc.com. If you don't get your question, you can always call Leslie or I. But this is sort of a big topic right now, in addition to applying for new loans and grants, et cetera. And I wanted to talk a little bit about local resources. We have a plethora of ongoing workshops. We just finished, along with Sierra Commons, the Business Creator Workshop, which was 4 weeks, a number of weeks, sorry. Nearly 100 people, businesses went through that program and graduated. Those are for people that are looking for the opportunities to start new businesses, so they're out there. That was successful, and I know the plans are in the works to replicate that with another, or do a new business igniter at Sierra Commons. So stay tuned for that. It's a 6-week course. You're launching Business Igniter April 13th. So there you go. Oh, thank you. Thank you, Amy. Sierra Harvest, we are always happy to help you. We love Sierra Harvest so much. Anyway, if you have not received your California Relief Grant, as I said, I think last time I talked to people, the initial approval was about 5%. Now they're at about 12%. So hopefully this next round with your application in, we're going to start to see more of our local businesses receive that grant. And that can be really helpful. But thank you.
All right, I'm not seeing any questions in the Q&A or over in the chat. Give folks a minute here to use one of those two tools. So assuming the America Rescue Package passes, what will that mean for us here?
Are you asking me?
I am, Kristen. You're the
well,
money.
Yes. So the American Rescue Package would be the new CARES, essentially. And there is a very large card. So this is the stimulus package where individuals are eligible for $1,400 checks, expanded unemployment, and direct aid for cities and counties. It'll be a little bit different this time, where the Treasury will essentially would fund the counties directly as opposed to funneling through the state of California. And what we're hearing is a little more flexible on the spending. So the money can be used for the county to backstop lost revenues, but also look at economic development opportunities going forward. So strengthening up the economy, building in some resilience. You may recall that with the CARES funding, some of that money was funneled into the economic impact grants and into the relief fund. So what we're hoping is another round of the relief fund, looking at, and I don't want to speak out of turn here, but potentially projects, things that have been on our wish list for economic development in the county that we've just never had the money for, have never been able to, but can definitely help build in that resilience, help diversify our economy and make us stronger to recover. So stay tuned.
All right. Any questions from the panel for Kristen and Leslie? Okay. Well, thank you guys very much. And let's go to our next agenda item, a hearing from Amy Arani, Director of Environmental Health, about platform kitchen operations.
Well, thank you, Caleb, and good afternoon, everyone. So this is a fun new opportunity, and it came about we have different divisions in environmental health. We don't just do restaurants. We have hazardous materials, land use. And under consumer protection, I have 2 dedicated inspectors, and one of those, Nicole Johnson, started researching what's called ghost kitchens in Sacramento. And so we started looking at that platform and saying, how can we launch that here in Nevada County, and who would it benefit? And so the idea of platform obviously is a kind of a platform that you can step on and launch. But we've had a lot of folks come in that want to start their own business. They have great culinary talent. Many of these folks out there currently operate what we call a temporary food facility. Those are those food facilities that you see at the fair, that are set up in food booths, things like that. We also have folks that are caterers that often use commercial kitchens. So the idea for a platform kitchen was to create an opportunity where an individual could express and sell their culinary talent using a pre-established brick and mortar food facility. To start from the ground up for a restaurant, it's an incredible expense. You're close to $100,000 on an empty shell. So for an individual to work with a pre-existing restaurant and have the ability to market their products is really a unique opportunity. So how it would work is a regular brick and mortar, what we call a standard, not moving, not a mobile food facility, but a retail restaurant kitchen. Let's say just as an example, Amy's Kitchen. So I have a standalone kitchen where I have my operational hours, say Monday through Saturday, and I open 7 and I close at 4 p.m. And then let's say another business approaches me and says, could I launch my product through your kitchen? And I say, sure. So then let's say Dan has his own platform kitchen, right? And he wants to sell his culinary gifts to the community. So I become a commissary kitchen if I'm not already one. And Dan then comes into my kitchen after I'm gone and closed, and he opens up his operation, say from 5 p.m. to 9 or 10 p.m. And what he does then is he's able to set up a kind of a point of sale station. He wouldn't have seating in the restaurant. People could walk in and give an order, and then Dan could prepare the food, package it up, and it would be to go. So you could have a full kitchen at your disposal, create all of your culinary, wonderful items that you have to offer the community. People can call in and place orders. You can set up a delivery system if you want. You can do curbside, and you can have people walk in and take orders to go. So it offers an opening for folks to start to make some revenue, and maybe eventually, actually, hopefully, they get enough that they can actually branch off and create their own brick and mortar. So it's an exciting opportunity. We've kept the cost really low because we are working with the operators, so trying to keep environmental health as a fee-based department. So we operate, all of our operational costs come from the fees that are collected. So starting out, we're keeping the costs very low for folks that want to submit an application. We've had a couple of folks already join in, Spiced, and there was another young lady that started out with her business that is getting into the platform kitchen. So they're really happy. It's very exciting to see. We're seeing more folks take an interest. And I really hope that this helps to open an avenue for some of our temporary food facility operators that were hit hard by COVID with the lack of the fairs and other things where they make most of their living. And it offers a different flavor for our community. There may be some folks out there that offer a different cuisine. That's always fun to introduce to our community. So very exciting.
Amy, where have you seen this in operation before?
Well, that's a great question, Dan. And you know, what research that Nicole, my employee, had done is she actually looked at a chef that had started what he called a ghost kitchen. And he started this in Sacramento. And we basically read through the articles and kind of saw what he was doing as far as allowing for other chefs to come into his kitchen, cook, and sell their product. And so I wanted to think a little larger outside that box and see how we could have a person come in and actually operate for a standard set of time, giving them more time to operate and kind of promote their business product. So they could advertise on the web, we'll be here at this certain time, you know, these days of the week, and people can plan around their schedule to go and pick up their favorite temporary food facility food, or, you know, a caterer that has a special cuisine. Okay, yeah, since we're going to be in business together, I might as well ask those questions, huh? Absolutely, absolutely. Great question.
What an innovative idea. The idea of having a commercial kitchen being used for more hours, and you start extrapolating that idea to almost anything, especially for people who dream of having a restaurant and maybe it's too much to make a reality, like you were saying, to be able to have a safe place to do it. That's pretty incredible.
So what they're doing, they're just basically paying some rent to the restaurant owner.
And that can all be negotiated. You know, a lot of times there is a commissary agreement, and depending on, you know, what the food facility wants to charge, if anything, that's an agreement that could be made. And maybe in the beginning, the food facility would welcome the extra press, the extra, you know, advertising and calling attention to their facility, which may also generate business.
And you share maintenance and upkeep costs.
Exactly. I mean, there's just, you know, there's a lot of opportunities here, and there's even opportunities in consideration with the Betts Hall too. I'd like to work closely to see if that could eventually become maybe a launching pad for some platform kitchens, if we can design it in such a way that, you know, we can alter folks, you know, coming in and days and times. We might be able to see some function out of that location as well. So I see a lot of great opportunities. And I hope a lot of folks take interest. So thank you.
Great. Any questions from our attendees? Please put them in the Q&A or in the chat.
I don't have a question, but I think this is so awesome, Amy. And I worked with La Cucina in San Francisco when they were starting up, which is a phenomenal success. And I'm going to put into the chat several SBDC. We have a whole restaurant and food training area for food businesses. So I'll put a couple links into the chat for people that are interested in that. But this is really exciting.
Yeah, it's great. Thank you. Wonderful.
So Amy, you have a question from Robert in the chat. Would this streamline the process for value-added food producers, such as those operating using the cottage food regulations?
Absolutely, Robert, that's a great question. I mean, if you're a cottage food operator, you're really doing a process that is predominantly what's termed by the code non-PHF foods. But let's say you have an aspect, a culinary aspect, where it's more along the lines, potentially hazardous foods or PH foods means those that need some type of control to prevent a foodborne illness. Either they're under refrigeration, they have to be cooked to a certain temperature, and they have to be maintained, held at a certain temperature. So let's say a cottage food operator has a certain culinary skill and they want to branch out and start this type of platform kitchen, you certainly could do that. We haven't actually looked at a model where a PKO came in that was a cottage food operator, had their restaurant where they're making those meals to go, and then as a side adjunct have their cottage food product. I'm willing to look at any kind of proposal that folks want to make when they come in, and we can work through how that would look in the PKO model. Great question.
You know, it's interesting, Kristen, you mentioned training, because I have a friend who used to volunteer. She was a professional baker at large commercial scale baker. And she would go into these type of kitchens and she would train these young entrepreneurs who wanted to do this, but had never, they'd worked in a home kitchen. They had never experienced what it's like to be in a commercial kitchen, which is an entire different scale, and how to use the facility and actually really build skills from somebody who used to make maybe 50 pastries to making, thousands of them. Is that something you're on mute, but.
Yeah, I get really excited about this. My background was in food and beverage. I was a food and beverage cost controller when I was a wee one, but I just posted too. We have a restaurant finance boot camp series coming up. Paul Bazzo teaches it. He's amazing. It's a 4-part series. And then is your food idea marketable workshop? So maybe you make salsa or kimchi or whatever. How would you market that? I mean, there's a whole slew on these websites and they're free. I just encourage anybody to really tap into this, because it's a group, it's our regional advisors, and they're all experienced, and learn from the people that have lost other people's money, learn on other people's money, as they say.
Yeah, thanks for those links. I'm sure a lot of people will be interested.
Yeah.
All right, looking down for more questions, not seeing any. Turn to the panelists. Any questions for Amy? All right. Thank you, Amy.
You bet.
So one question that one good trend we've been seeing is less community complaints about businesses. Actually, Amy, maybe you could address this. We're hearing less complaints, and so that's really good news. I do want to share with the attendees that the website the county was using has changed. Before, if you wanted to register a complaint about a non-compliant business, you would go to Ask Nevada County. That's now been simplified. So if you go to the My Nevada County page /service request, and it's really a good looking site, and it allows you to make every type of service request, from potholes to, the COVID issues as well, but very comprehensive way for you to engage with county services. And I know that came out of CDA. So Amy, if there's anything you want to add.
No, that's great, Caleb. Thank you for mentioning that. It's really a better system where you can quickly access. It's a pictorial page when you get there, so you can quickly hit the button of where you want to go. And yeah, it's a great resource. It's where folks will submit their complaints, from COVID to solid waste to hazardous materials to anything. And it really is an easier system to use. And we have had a lot of feedback from both our restaurant owners and the public. And, we are here to work hand in hand with you. And this has been a very tough journey. We recognize that. We're here with you. Public Health has been doing a fantastic job with their staff and time, and know that Environmental Health is also here to support our businesses and our operations. Contrary to some comment and suggestion, but we're always here to help you be successful. So please reach out anytime if there's anything we can do. Thank you.
All right, thank you, Amy, and thank you, everybody. I want to just point out that our next monthly meeting is April 7th, same time, same place. Please send me, any agenda items, topics that you would like early. I can see if I can put together and bring panelists in. As I think many of us are hopeful, hearing President Biden talk about having all adults immunized by the end of May, with the county possibly moving into red in the next, and maybe even into orange. The COVID task force might go more from this sort of relief and the urgency of what we're dealing with to really the recovery piece. And so as you think about the needs of your businesses coming back online, or, getting back into, just restarting in many ways, think about what resources you might need from the county, and we'll be happy to bring them to this forum and other places as needed. So with that, let me close it, send it back to our co-chairs, Supervisor Miller and Supervisor Schofield. You're mute.
Yeah, I knew that. I just told it, Kristen. You know, I guess frustration is what's setting in with the business community. And I think it set in a while ago. And, the return to normalcy and let's get normal. And, those are all words I hate to be a downer on this. Businesses don't want to hear that anymore. They're trying to be normal, even though they're operating outside the guidelines. It's for them. It's frustrating for them. It's a matter of life and death, and that of their employees and their businesses. So I think the quicker we can move on this, and the quicker we can get into tiers that allow them to open up freely and lawfully, it's going to be a whole different ballgame. But businesses need to be able to trust us, and right now they don't. And so it's a situation that I don't think we've ever felt before. And, honestly, in 32 years being an elected public official, I couldn't believe it when I added the years up the other day, is I've never been in a position where I've had responsibility but no authority. And authority to set policy, authority to make decisions for our community. And, to me, that's really frustrating. And so I'm just hoping that we can get back to a point where, locally we can work with public health and all the qualified people there, and the electeds in the different jurisdictions. We can start making decisions that certainly move our community forward. That's all I got.
Thank you. Before I go to Supervisor Schofield, I'd love to take this question that Barbara Bauschel put in the Q&A, and Ryan, if you would maybe be able to answer it. If you could just review for her and others, when can you go back over what businesses can be open and what the rules are, I guess now, while we're still in the purple tier? And then it's interesting, I've been getting this one too. Is there any flexibility in indoor meetings? It looks like we're getting a few more questions.
Yeah, so rather than going into the exact details of each sector, I'll just try to post out the links to the guidance itself. But basically, at a high level, the purple tier is almost entirely outdoor activities, with some exceptions. So restaurants are allowed to do outdoor dining, et cetera. And then the red tier allows for lower capacity, but the beginnings of indoor activities. Some businesses can open at the red tier at 25% indoor capacity. Some, such as gyms, it's 10% capacity at the red tier. And then those start to scale up with orange. You have now greater capacity indoors, and then yellow is much closer to quote unquote normal, still with guidelines in place. As I expressed, I do expect that as we continue to vaccinate and as we see trends continuing to less and less cases, that we are going to get there despite the disappointing news this week. And it's also entirely possible that, as we've seen in some other places, that when you start to layer in the protection of vaccines, that changes start to be made to the frameworks themselves, and the vaccines start to become part of that picture. So stay posted, and we can continue to use this as a forum for communicating those changes. And I'll try to find some links for you right now on the specifics.
Do you want to speak at all to the meetings and gatherings?
So in-person meetings, indoor meetings are strongly discouraged at this point. Gatherings basically are prohibited I mean, there are parameters, and I'll post out the links to the guidelines for gatherings as well, but it's basically, my recollection is no more than 3 households with parameters in place. I think in purple, they're supposed to be outdoor gatherings. But again, I would rely on the written guidelines, so I'll post out the links to where you can find that.
All right, thank you, Ryan. Let me just check. I see another question popped up. What is being done about the restaurants that are serving indoors? Maybe Amy, you might take that.
So you bet, I'll do my best. That's a great question. It's a very it's a frequent complaint that we get in environmental health, and I think a lot of people don't really truly grasp that what environmental health, we are essentially an arm of support with public health, but the reason with the restaurants that there has been an increase in our education and outreach is because they hold a permit and we inspect them. So what our current process is we are doing our best to educate. We reach out to the operator every complaint we get, and we send emails or we do site visits and ask them to please, adhere to the current public health guidance and order. And as Supervisor Miller had indicated from his constituents, sensing the urgency, we do have a lot more operators that are allowing indoor dining. So at this time, in working with our county council, we are working on a process that is rather involved. And as we go forward with any action that is stronger than education, which is obviously the last thing we want to do, because after COVID, we still have to work with our restaurants and help them be successful. That's the role of environmental health. So as we move forward, it's going to take a little bit of time because there's a process that gets set up. If there is an appeal process or a hearing, or there's any kind of permit suspension, these will all take time, but know that every complaint is addressed. We do reach out and try to gain compliance from the owner operator to prevent going down a punitive avenue for a COVID operation.
All right, thank you very much, Amy. And yeah, let's close it out with Supervisor Schofield.
Well, I'm an echo Dan and the frustration, and I just want to say I appreciate Ryan and Amy, the work that you're doing, and I know you're just as frustrated as we are. So I don't think it pays to vent on here. I feel like we're being penalized a bit for being a smaller county. I look at somebody like Placer and think, oh, give me a break. There's got to be pockets in Placer of 100,000 people or so that are probably higher than we are, and yet they're in the red. And the red is, to me, gives so much more flexibility than the purple that we're in right now. So I guess the only thing I would say, Ryan, how often are we able to look at those tiers? Is it weekly?
So yes, the data is updated weekly. And so Placer, I think, hit the criteria for the red tier yesterday. And so they would go to with next week's update, having met it for 2 weeks in a row, they would go out, they would go into red. If they go the other direction, they will remain in purple. If we are able to hit red next week, then it would be the following Tuesday when we would advance to red.
Okay. Well, I guess, as I said earlier, it's as much as we can, patience. Thank you to everybody out there and what you've been going through. Thanks, Caleb.
All right. Yeah, thank you, supervisors. And thank you, Kristen, Leslie, and Ryan and Amy. And thank you all of you for attending today. We will send out a link to the video shortly, as well as some of the resources that were shared. And please feel free to pass that information on to others and encourage them to attend next month's meeting. With that, thank you. Goodbye.
Thanks, Caleb. Appreciate it. Amy, Ryan, Kristen, thanks, Ed.
Dan?